Hi everyone, my name is Steve with InsureMeSteve.health, a Revolt Healthcare Alliance agent. So I want to talk about one little thing today, and I got a silly little picture. Looks like a helicopter, but it's ambulatory air care. So worst thing happens to you, you're in a terrible accident or you have a terrible illness and you have to be airlifted out of wherever you are. There's a couple of things I think you need to be aware of if you ever need to be airlifted. So most of the airlifts or the ambulances that are in the country are privately owned by investment funds or even publicly owned on the stock market. You see, a few years ago, about over 10 years ago, there was a huge realization that there was a lot of potential in this market. A lot of these air ambulances are not in network with any of the carriers because of the fees that they charge for their services. Now, think about this. They've purchased a ambulance, or I'm sorry, they've purchased a helicopter. They got to land that helicopter somewhere and store it. They got to put fuel in it. They got to pay for a pilot to be pretty much on call 24/7. And they have to pay for paramedics to be on call 24/7. So is there a lot of cost associated? Well, certainly. But I don't believe the cost justifies some of the fees that they charge. And so I want to talk a little bit about that. They're not in network, so they're free to charge pretty much whatever they want without having to negotiate with the big carriers. And they realize you're in an emergency situation. And so they realize that they have the potential to charge you enormous fees for transport that simply could be just a couple of miles. There was a book that I recently read, The Price That We Pay. I really recommend it if you want to understand how the healthcare system works. The Price That We Pay. And in it, the author referenced a story where the paramedic that worked on the ground ambulance also was a paramedic with one of the air ambulances as well. Now, in this particular geographical part of the country, there were a lot of air ambulances competing for the same geographical area, basically competing to respond to the same emergency. And this particular air ambulance company would pay the paramedics if they were in the ground ambulance, if they referred the patient to the air ambulance. So here you are in a situation where you might have just been in a terrible car accident. All you want is to be taken care of. The paramedic jumps out of the ground ambulance, immediately assesses that you need emergency care, and they call up the air ambulance to come and transport you because it's the fastest way to get you to the hospital and potentially save your life. Now, is it fair that paramedic that was there with you on the ground is the one referring the helicopter and then getting a referral? I don't think so. But it's unfortunately the way our healthcare industry works. With Revolt Healthcare Alliance, I have access to the largest patient advocacy company in the country. And they are frankly the enemy of air ambulance transport companies like this because they fight on your behalf to get the claims handled the right way with the right amount of fair charges for the services that they provide. Remember, my name is Steve Stump, and if you have employees or you are an employee, when you insure with me, you insure with Steve. I am your dedicated health agent providing concierge service. Check me out at InsureMeSteve.health, and if you're interested in a quote, just scroll down to the bottom, complete the form, and you and I will talk soon. Thank you and have a great day.